Lyza is a medication used to prevent pregnancy, also known as the mini pill, because it does not contain any estrogen. It contains norethindrone, which is a hormone that prevents pregnancy. While the mini pill is more effective than certain other methods of birth control, it is less effective than combination hormone birth control because it does not consistently prevent ovulation. It is usually used by women who cannot take estrogen. To reduce the risk of pregnancy, it is very important to take this medication exactly as prescribed. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases. It is recommended to take Lyza at the same time every day to maximize its effectiveness in preventing pregnancy. Before taking Lyza, make sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily at the same time each day. It is best to begin taking this medication on the first day of your menstrual period. If you begin taking it on any other day, use an additional form of non-hormonal birth control for the first 48 hours to prevent pregnancy until the medication has enough time to work. After taking the last tablet in a pack, start a new pack the next day. There is no break between packs, and you do not take any reminder tablets. Your periods may be irregular, or heavier/lighter than usual, and you may also have vaginal bleeding between periods. Do not stop taking your pills if this happens. If you miss a pill, start a new pack late, take your pill at a different time of the day than usual, or have diarrhea or vomiting soon after taking a pill, use a backup method of birth control every time you have sex for the next 48 hours. Ask your doctor or pharmacist about how to switch from other forms of hormonal birth control to Lyza. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Lyza include nausea, vomiting, headache, bloating, breast tenderness, weight gain, spotting between periods, and missed/irregular periods. If any of these effects persist or worsen, contact your doctor. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Contact your doctor right away if you experience any serious side effects, including lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. While a very serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice other effects not listed above, contact your doctor or pharmacist. Before starting Lyza, it's important to let your doctor or pharmacist know if you are allergic to norethindrone or other progestins. This medication may also contain inactive ingredients that could cause allergic reactions, so be sure to discuss any allergies with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, including any abnormal breast exams, history of cancer, especially endometrial or breast cancer, low levels of good cholesterol, HDL, depression, diabetes, severe headaches/migraines, history of jaundice during pregnancy or while using hormonal birth control, liver disease, and unexplained vaginal bleeding. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications, including prescription drugs, non-prescription drugs, and herbal products, that you are taking. It's important to note that Lyza may cause blotchy, dark areas on the face and skin, melasma, and sunlight can worsen this effect. It's recommended to limit sun exposure, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. Lyza should not be used during pregnancy, so if you become pregnant or think you may be pregnant, be sure to notify your doctor right away. Additionally, this medication can pass into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Lyza, as they may change how the medication works or increase the risk of serious side effects. Some drugs, such as griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, and certain HIV drugs, may cause hormonal birth control to be less effective, potentially leading to pregnancy. It's important to discuss any new medications with your doctor and consider using additional reliable birth control. Additionally, be sure to inform your doctor of any new spotting or breakthrough bleeding, as these may be signs that the birth control is not working effectively. It's also important to note that Lyza may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Lyza and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea, vomiting, and sudden or unusual vaginal bleeding. It's important not to share this medication with anyone else. While taking Lyza, it's important to have regular physical exams, including lab tests and medical tests such as blood pressure monitoring, breast exams, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts, and report any lumps right away. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you miss a dose of Lyza, refer to the product package information for advice on what to do. It's important to use backup birth control, such as condoms or spermicide, to prevent pregnancy if you miss a dose. If you have any questions, don't hesitate to ask your doctor or pharmacist for guidance. If you find it difficult to take your pills as directed, it's a good idea to speak with your doctor about possibly switching to another form of birth control that may be more suitable for you. It's important to store Lyza at room temperature, away from light and moisture. It's best not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to discarding Lyza, make sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. It's always a good idea to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.